2025 Headmaster Mandatory Skill. Assist with use of bedpan and measures and record urine output with hand washing. Opening procedures. Knock on the door. Greet and address the resident by name and title. Introduce yourself by name and title and explain the procedure. Ensure that the bed wheels are locked and that the bed is in a low safe position. Place the call light within the resident's reach. Provide privacy by closing the privacy curtain. Ask the resident about their preferences. Use actual hand sanitizer to wash hands. Gather supplies. You will gather a total of 7 items, including the clean barrier. Place the clean barrier on the overbed table. You may use a Chuck's pad or a towel. Gather remaining supply items and organize them on the clean barrier on the overbed table. You will gather a standard bedpan, toilet paper, hand wipes or wet wipes, 2 pairs of gloves, and a linen protector. For the linen protector, you may use a Chuck's pad, a towel, or a waterproof pad. Try to organize your supply items on the overbed table in the order in which you will use them. This will prompt you as to what step comes next. Move the overbed table so that it will be close to you. Raise the height of the bed to a comfortable working height for yourself. Ensure that the head of bed is flat. Don clean gloves before placing the linen protector and the bedpan. Prepare your linen protector by manually unfolding it. Do not shake it open. Roll it away from you. Then turn it around. Line the linen protector to ensure it will be completely underneath the resident's buttocks and peri area after placement. You may place the linen protector in one of 2 ways. You may instruct the resident to raise their hips, as I'm demonstrating now, or you may assist the resident to turn on their side to place the linen protector. Correctly place the bedpan, ensuring the sheets and the gown do not fall into the bedpan. Remove gloves without contaminating yourself and dispose of them into the waste bin. Use actual hand sanitizer to clean hands. Raise the head of bed to a high Fowler's position. Double check to ensure that the bedpan is completely underneath the resident's buttocks and that the call light is within the resident's reach. Ensure that the toilet paper and hand wipes are within reach. Instruct the resident to use the hand wipes to clean their hands when done. Instruct the resident to signal when done. Stand completely behind the privacy curtain. Once you return to the bedside, lower the head of bed. Don clean gloves before removing the bedpan and linen protector. You may do so by instructing the resident to raise their hips or assisting the resident to turn on their side. Ensure to grasp the bedpan before removing it. Ensure that the sheets and gown do not fall into the bedpan and does not come in contact with your clothing. Dispose of the soiled linen protector appropriately. The evaluator will pour an undisclosed amount of urine into the bedpan. Pour the contents of the bedpan into the measuring container without spilling or splattering. Rinse the bedpan. Empty the rinse into the toilet or bedside commode. Dry the bedpan. Ensure that it is completely dry. Replace the bedpan in storage. Measure the contents of the graduate by squatting and getting at eye level. You will measure in increments of 25. You must come within 25 milliliters of the evaluator's reading. Empty the contents of the measuring container into the toilet or bedside commode without splashing. Rinse the graduate and empty the rinse into the toilet or bedside commode. Ensure that it does not splatter. Dry the graduate. Ensure that it is completely dry. Return the graduate to storage. Replace the toilet paper and the hand wipes in storage. Remove the clean barrier and dispose of it appropriately. If you use the chunks pad, dispose of it into the waste bin. If you use the towel, dispose of it into the soiled linen hamper. Remove gloves without contaminating yourself and dispose of them. Use hand sanitizer to clean your hands. Return the overbed table. Record your measurement on the pre-signed recording sheet. Use hand sanitizer to clean your hands. Ensure that the call light is within the resident's reach and that the bed wheels are locked. Ensure that the bed is in a low, safe position. Ask the resident if they want their privacy curtain to remain closed or open. Ask the resident about their preferences. Remove any wrist, hand, or finger jewelry. Turn on both handles. If your sink has one handle, turn that one handle to the center setting. Wet wrists, hands, and fingers. Remove any excess water by lightly tapping your hands together or lightly wiggling your fingers. Apply a generous amount of soap to your hands. Lather your hands for at least 20 seconds using the storm count 1,000, 2 1,000, or 1 Mississippi, 2 Mississippi, all the way to a count of 25 will ensure you lather your hands for that at least 20 seconds. Ensure that your hands remain below the level of your elbows with fingertips down, and ensure you do not touch the insides of the sink. If you touch the insides of the sink, make sure you make a self-correction. Clean underneath your fingernails. Rinse all soap thoroughly from wrists, hands, and fingers. Double check to ensure you removed all soap. Remove excess water by lightly tapping your hands together or lightly wiggling your fingers. Use paper towels to dry hands, beginning drying each individual finger on each hand first. Dispose of your paper towels into the waste bin as you use them. Dry remaining areas of your lower hand, wrists, hands, and fingers. Use as many paper towels as you need to ensure your hands are completely dry, disposing of each towel after each use. Get a clean, dry paper towel to turn off the handles and dispose of the paper towel into the waste bin. State skill complete.